Hey guys, this is Kai for week 51 of ItsAMansWorldFTM1. The topic this week is doctors. 51 doctors. That sometimes feels like how many doctors I've seen to deal with this transition, if you will. Let's see, the first doctor I saw for the transition process was my counselor, mental health person. She is based out of Pennsylvania, and I found her on the Laura's Playground list, and I talked to her on Skype. She's very nice. She has a flexible payment plan, and she's now accepting insurance. Sadly, though, not my insurance. I think she's taking Cigna. She's awesome. I interviewed about 12 doctors before I started talking to her, and she's the only one I really connected with, so she's the one I ended up sticking with. And she was very helpful, not only for the transition stuff, but dealing with things that I was feeling prior to transition, like depression and all that other stuff. I like her a great deal. She's just generally supportive, whereas doctors that I've spoken to in the past in the mental health department have usually been standoffish, Freudian. They ask a lot of questions, but they don't actually have conversations with you, and they seem very detached from the subject. So it's hard to feel like you're talking to somebody who's paying attention or who cares, because they're not paying attention and they don't care. She is one of two exceptions to that problem, and the first doctor, Jesus, was about 15 years ago, and he was very nice, but he transferred, and so I lost the doctor. The first medical doctor I talked to about transition was actually about 5 years ago. She was very helpful in other problems. She was an endocrinologist, so she was helping with my endocrine system and other issues that I had. I mentioned that I wanted to transition, but she was very hesitant to the topic. She didn't seem that supportive, and she wanted to deal with other things first before we discussed that. But I tried to bring it up to her to say, okay, so what do I do if I have these feelings? And she pretty much just kind of blew me off. So after I spoke to my mental health counselor and started pursuing doctors in the area who could help me with getting testosterone, I worked with one doctor who was recommended by my insurance and was covered by them. But he was about 90 years old, and he operated a practice that he was too old to maintain, frankly, and he would make 15-minute appointments, but his appointments would last 2 hours at a time. So it was not only common, but the norm for people to be sitting in his waiting room for hours. Like, they would have an appointment in the morning and they would get seen in the middle of the afternoon. His office closed at 8, but he would have patients there as late as midnight and then have to repeat the process at 8 o'clock in the morning the next day. Because his standards for practice were so old-fashioned, he refused to even talk about transition until I was thin enough to meet whatever standards he felt were necessary in order for me to have a successful transition. And so I sought a second opinion. I started attending a local clinic that specialized in LGBT issues, and who has, according to their website and the people who make appointments, doctors who are trained in transition and understand the process. So I was scheduled with a doctor, and she was very standoffish, didn't have good bedside manner, spent a lot more time taking notes than actually looking at me. It was a very impersonal experience. I actually had a better relationship with her prep nurse than I had with her, and so I didn't feel like I could talk to her because she was very new to the practice. She had transferred from somewhere else, and she had a little booklet on how to handle trans patients and what the process was. So every time I saw her, she would open the book and flip through her highlighted pages and be like, okay, so you've been here before, and you started tea a month ago, so that means I have to give you 3 milliliters of tea this time, or 3 months supply, or whatever. So she didn't have any experience with the topic. She was willing to have trans discussions with me and was willing to follow through with the procedure, but the procedure was new and alien to her, so she didn't really... I was just a test dummy, you know what I mean? Like, she was learning how to treat trans patients by having me as her patient. And I'm not an experimental case where you can learn the ropes on. Like, if she had a little bit more experience and didn't need a book, a cheat sheet, if you will, to figure out how to give me testosterone, you know, it would be okay, but she needed a cheat sheet to tell me how to, to prescribe me testosterone. She also gave me a pap smear, and she was sick that day. She had an allergic reaction to something, or we don't really know. But she was kind of impersonal beforehand, but because she was sick, she was disoriented and just wasn't in a good headspace. So when she gave me a pap smear, it was like painful and intrusive, more so than normal, and that was kind of the last straw. So I'm actually changing doctors to a different doctor who was actually recommended by a friend who actually goes to this clinic as well. But I'm going to see them in February or something, or March. So right now it's a bit of thumb twiddling. I haven't actually met them. My experience with doctors as far as this process has been pretty awful, and I don't know if I'd recommend it. Well, even though they're covered by my insurance, they're terrible. I mean, the 90-year-old guy really shouldn't be practicing anymore. He's too slow, or he should block 2 hours per patient and only see 5 people a day. But I guess he needs the money, so he's just there all day. He'll suddenly leave and go have lunch and like not tell anyone, so the patients are just waiting. And he's kind of a criminal person. Like, he's treating his receptionist really poorly. He doesn't accept credit cards. It's just, what day and age are we in, you know? And then the doctor I had until recently was perfectly not terrible, not great, you know, impersonal, aloof, not really focused on the fact that I'm there to get treatment, interested in my health, but not in the things that I was interested in. So like, I was there for transition, but instead she got a counselor to tell me to stop smoking, and they peer pressured me and bullied me into agreeing that I would quit. Just a really nasty pap smear. It was just a bad experience. But besides that, you know, I haven't had any good experience with the doctors beyond my mental health counselor, who is very nice, but it's kind of unrelated to the medical journey. A funny story. So when I got T the first time, they gave me enough for a month, which was every other week, 0.5 milligrams? I don't know. You know, 2 injections, small dose. And then she prescribed me a 3-month supply of the dose. But she still gave me the tiny vials. But she was also supposed to give me a 3-month supply, but she gave me 3 vials. The tiny vials is a 2 weeks dose, because it's 0.5 every week. 0.5 every week, which is 2 weeks, times 3 is 1.5 months. First of all, she said, oh, we're going to electronically wire your prescription down to the pharmacy, which is in the same building. But the pharmacy never got it, so I waited for an hour. And then they said, well, we don't have it. So I had to go back up to her floor and get the prescription on paper, and then go back down to the pharmacy, turn it in, and then wait an hour. This is a clinic. It's fairly busy. There's lots of people getting prescriptions there. I waited 2 hours for my meds. And then when I got my meds, I only got half my dose, even though she prescribed a 3-month dose for me. And not only that, but then I got the little tiny fucking vials. I didn't get a big vial, I got the little tiny vials. It's just like an experiment in failure. She doesn't know what to prescribe. She's looking in a book. So when she fills the prescription, she's just pulling up random things and typing numbers without understanding. Like, the 3 little vials would have been enough if I was on my previous dose. But I'm on a new dose. It should be bigger. So I spent a week and a half calling and playing phone tag with one of the reps there to be like, what's going on? Why do I have such a small dose? I'm supposed to have twice this. Why am I getting the little fucking tiny bottles? Nobody knows. So my last dose that I have is next week. And I have to call them tomorrow and be like, can you prep my second dose? Because I need another month and a half before I go back in and get another appointment to get another prescription, because there's no refills on this shit. I'm very frustrated. So clinics are fun. Cheap and awful. Yeah, go to clinics. Yeah. That's it for week 51. I never know what I'm going to talk about next, so I have no idea. We will find out together. Anyhow, thanks for watching. This is not in my car. I know some people were like really excited about last week's video where I filmed it in my car. I wasn't traveling today, so I just filmed it here. So I will talk to you guys next week. And maybe next week I'll do it in the car. We'll see. We'll see. Have a pleasant day.